Hey everybody, welcome to another exciting episode of Clinic Gym Radio. I am always your host. This is Dr. Josh Satterlee, and today it is my pleasure to be joined by Tony Gentilcore. Tony, how are you?
Hello. Despite my amnesia, I'm very happy to be back.
So for my listeners, as you know, we previously had Tony on the podcast a couple years ago. Before we hit record, Tony made it very clear he doesn't remember me, anything about me or the podcast. So we're starting with fresh eyes and ears.
Oh man. Yeah. It's been a long year, Josh.
Well, for my listeners, the reason is Tony's an incredibly sought after human presenter, father, husband, and also recently trained one Roseman Pike for her Netflix movie, right?
Yes, that was a lovely experience. That was, I had to make a caveat because I know she posted a video of her deadlifting. And I of course was like, oh, this is cool. She shared it. She let me know she was going to share it. And then I see the comments in the bottom. Most people were very nice to her. And then of course there was the one or two people like, oh, thanks for bringing over the UK variant of the coronavirus and and you're not wearing a mask. And I was like, that was summer of 2019 that we did this video, like relax, like,
awesome.
But when she was in town filming that movie, I worked with her for, close to 2 months. So yeah, very lovely person in person. It was nice to work with her.
I hear that she's great. I hear that she's nice, and she always gets cast as a horrible person.
Yeah, her best roles are
no different. If you haven't seen, what is it called? I Care a Lot.
I Care a Lot. Yeah, with Peter Dinklage. Yeah.
Yeah, you want to throw your shoe at the TV screen.
Oh
after that movie.
Not an enjoyable character to root for sure.
No. So, anyways, speaking of deadlifts, you are a connoisseur of deadlifts. You are the sommelier of deadlifts, variations. What their effect is. And you've been kind of diving deep on the idea of asymmetry is okay.
Sure. Yeah.
And there may be different stances, different ways we're going after the same goal. I think almost universally we can say we want all our clients to perform some sort of hip hinge at some level, but how that occurs, you've been kind of going down that rabbit hole.
Yes, I'm very much a fan of saying that the human body does not live in a textbook. This is not to downplay the information in those textbooks. Like I think that, of course, is information we all need to know and learn and appreciate and respect. But when it comes to actually working with a live individual in person, what we read in the textbook won't necessarily carry over to what's going to allow someone to perform a movement well. And to perform it safely. We have to understand that everybody's a little bit different. We all have the same articulations and the same bones, but the lengths and where they're located and angles are all a little bit different. So I've really tried to encourage more fitness professionals to lean into this idea that asymmetry is normal and asymmetry is okay, within reason, of course.
It's like being in person, right? Like it's okay to be different within reason, of course, Of
course, yeah. You don't be too weird.
Yeah, well, I mean, if you start every greeting with the F word, that might be pushing the limits, but
Sure, yeah, of course.
Yeah.
But I agree with you in that I'm a firm advocate and fan that people should be squatting, should be doing some form of hip hinge, but that I don't agree with the idea that everyone has to back squat or everyone has to do a straight bar deadlift from the floor.
Right.
So this is where we try to find the individualization of those lifts and, taking people through a really simple screen in the beginning. Like we don't have x-ray vision, of course. That'd be kind of cool if we did, but
it's always interesting when people do have x-ray vision, by the way, in the movies, because it's like, it's not truly x-ray vision. Like you're not seeing through the soft tissues. You're like appreciating the soft tissues, meaning you see through their shirt, but you can still see outline of their body.
Yeah. Come on, Hollywood, get it right. Jeez.
I know. Either go full x-ray or don't claim it,
Don't do it. Yeah. So, outside of having x-ray vision, there's some simple non-incendiary screens we can take people through, like a hip scour, and actually just watching them move. Like, I often tell when I meet with a client for the first time and I'm assessing his or her squat, I'll have the person do a body weight squat in front of me. And then from there, if it feels pinchy in their hips or it doesn't feel great, I'll say, well, why don't you just turn this toe out a little bit or go a little bit wider stance, or does that feel better? Oftentimes they may say yes. And I'll say, well, okay, let's lean into that a little bit. Let's load it and see if it feels the same. And so, yeah, it's this really weird assessment where if I want someone to improve their squat, I look at their squat.
Oh, slow down. Hold on. Let me take notes here.
Yeah. Take your note.
Back. You said when you
it's really weird. Yeah.
You want to appreciate the squat. You said you have them do a push-up. What did you say?
Yeah, exactly. Yeah. In the water.
Okay. Upside down though. That's the only way to assess. Yeah.
There's of course things that I just think the connotation of assessment can be intimidating to people, especially if they're not used to being in the weight room on the gym floor. So, the last thing I want to do is put the individual on an assessment table or a massage table, do all these rudimentary, like microscopic assessments and make them feel like they're being judged on every little nitpicky thing. I do the hip scour because it does give me an idea of like what's going on, passively. But then I get more information than just watching them do the squat or the pattern itself. And I just try to see if that information matches. And oftentimes, between those two, I can often better match the stance, the variation, the depth, all that stuff to the individual, and just to make it so it's a safe, clean, efficient, movement that they're gonna get a lot of benefit from.
That's awesome. Let's go back in time if we can, since we're talking about Active Vision. Let's do some. You can be Flash, okay? You can go. Doesn't he go? Can he go back in time?
You know what? My wife watched The Flash. I did not. So, but I think you're probably right. It's like a Superman thing where you can fly backwards. And let's
assume he can and that you can. So there you are, young trainer, super motivated. When did you first kind of get hit in the face with the idea of like, hey, you might need to change this deadlift variation? Because you at your core you are a power lifter. I was coincidentally enough, I was asked this question today. I actually went to the first gym that I've worked out at other than my studio today. It's the first time being I went to a local CrossFit gym here that I used to work out at prior to the pandemic. During their off hours, like I have nothing against CrossFit, but I don't do CrossFit. I'll just train at the CrossFit. But the new coach there asked me like, oh, how is it that you train? And I tend to focus on the big three. Yeah.
So squat, deadlift, bench. I've never competed in powerlifting. I've coached a smattering of powerlifters here and there, but I have zero interest in competing.
Other than Roseman Pike?
Other than Rose, she's training for 2024.
Okay.
That'd be kind of cool, actually.
Yeah.
I gravitate towards those big three, and I would say when I started having a little bit more of an epiphany, I wouldn't even say it was right away. It was probably, once I started getting into when I was with Cressy Sports Performance and just understanding that, not everyone has to do a conventional style deadlift from the floor, especially working with professional athletes. And we weren't in the business of hurting them or making them worse.
Plus the incidence of previous, surgery or sprain, strain, groin pulls, all those things. Because that's the other thing that we haven't even touched on. Like, if you work in rotational athletes, like baseball players or golfers, man, you get a lot of these like overlaid, I don't know what you would call it. Like, so these sports hernias or abdominal strains or even oblique strains that seem to be really centered around the hip and are symptoms of the hip dysfunction.
Yeah.
And I personally have flared up to people that I wish I never did because I, looking back, relatively forced them into an exercise they probably shouldn't have been doing.
Yeah. And so a lot of it's trial and error. I'm in the business of just helping people get into better positions and having the movement feel safe, so to speak, or stable would be a word I would probably use. And then just, making, and then progressing accordingly from there. Like, I don't think it's rocket science. I just had to get out of my way early in my career. Like, like we're all young whippersnappers at once. We know it all.
Yeah.
Like,
I think that's an interesting point that, for those younger providers, younger strength coaches out there, one of your jobs, I think, if you're going to go after the strength coaching thing is this is really tough to say. It's to develop a library of exercises for any movement. So let's just say hip hinge. Develop as many variations as you can, record them somehow. And I would say probably the best is filming yourself doing them.
Sure.
But then resist the bias to go into one because of some reason other than I've assessed this person and this is the one that they match up with. Like, it's like Instagram is awesome for offering up variations of exercises. Like sometimes I'll go, oh, wow, that's a totally cool way. But it also biases you to, well, if that's what, LeBron James is doing, then it's awesome for, footers. And you're like, that last jump was the big one. But although you should note the variation that he might be being taken through.
Sure. And also with Instagram, we also have to realize too, that that's just a snapshot of not only their training session, but their training approach.
I thought it was more like a documentary. It was kind
yeah, exactly. Yeah, Some would think that. Yeah.
Interesting.
But yeah, I mean, I think the industry is doing a much better job of understanding that there, variation, understanding the, finding the right variations for people, and that asymmetry isn't like this disease, and that it is okay and it's normal. It's definitely getting better out there, which is refreshing. It's a less of an uphill battle.
Oftentimes I found it's not a permanent sentence too.
No, not at all.
When you create a range people can work out and they get stronger, oftentimes they migrate back to what we would consider sometimes the normal range or a normal position. They just, been sitting behind a desk for however long, or they've been doing some sort of work that kind of has jacked them up.
And I might have said this term last time you and I spoke, but I've used this term a lot of late, especially since I ruptured my Achilles. My job is to find the trainable menu for my clients and my athletes. Like I try to see, given their injury history, given their ability level, given their goals, let's find your trainable menu. What can we train, and how can we train? Let's find the right dosage, and let's attack it. Let's train hard. Let's train with appreciable weight. I'm not there to baby people, but I'm not there to crush them either. Like Dan John is famous for saying, easy training is good training. I very much fall underneath that umbrella as well. Like I prefer my clients leaving a session feeling as if they could do more. To me, I feel like they're going to recover from that and they're going to be able to come back and train hard again.
Right.
I think more and more fitness professionals are latching on to that mentality. Like there's less of like, I must destroy you mentality. It still exists, of course, but
I often wonder how much of that is just like our inherent human nature of balance. Like as the world gets softer and more padded. So
sure.
Look at playground. You have a young son. So like playgrounds, as they become rubbery and softer and the heights are safe, they're no longer, I remember like forts made out of telephone poles where we'd jump out of the window, but you knew not to land a certain place or you get a huge telephone pole splinter in your hand. Anyways, as that gets softer, do the kids want to run into each other more because they're like searching for that balance of pressure and trauma, for lack of a better term?
Yeah. And
so those times when we do want to be crushed in a workout or our client wants to be, is it because somewhere else they're being tamped down?
Well, I mean, I here in Boston, like I train quite a few of my clients are very type A, like they're white collar lawyers, doctors, CEOs. And I think they come to me and they want to be told what to do and they just want to get after it. And I'm all for that. Believe me, I'd rather have a client who like wants to work hard. But oftentimes I have to kind of re-educate them. Like, let's pump the brakes a little bit. Like, let's make sure that you're recovering. And also that, and again, going into the root of this conversation, like finding these variations like that match your anatomy and ability level. Cause I want this to be a sustainable relationship. Like you crushing yourself and getting hurt all the time is not going to be sustainable. So going to the variations of deadlifts. Sure.
First off, I know that you have some like online courses and some presentations and whatnot. Where can folks find that if they kind of want to dive down to what we're talking about here? To get a more thorough idea of how I go about coaching that lift and how I assess would be the Complete Shoulder Hip Blueprint. There's version 1 and version 2 and 2 is a sequel. It's new material. It's a sequel that I've done with Dean Somerset. And both those can be found either on my website, which is TonyGentilcore.com, or CompleteShoulderHipBlueprint.com. And you can get both. Geez, could you find any two URLs that are any more difficult to spell than those two? I know we couldn't find something like,
getbig.com or something.
Exactly. That's awesome.
But those would be the main resources for that, because obviously it goes into shoulders and hips assessment and breakdown of everything.
Yeah. So for our listeners, Tony, could we explain some of these differing setups and stances verbally? Because we're doing an audio podcast, so we don't have the benefit of a picture here. But can we kind of explain some of them? And maybe I'd love to do remember that old game you play in elementary school? It's like match the picture with the word, if you find this, then you might want to bias towards this, or if you see this would be a good exercise.
So I'll say right out of the gate, 90% of my clients, if not more, stick with the trap bar for their deadlift variations. And the trap bar is the contraption where you're sitting in the middle of the bar and the handles are at your sides like a suitcase.
Yes.
It's also
by the way,
go ahead.
No, earlier before we hit record, we were talking Kabuki strength makes absolutely by far the best trap bar you can get for a multitude of reasons. One of which is they realize you need to adapt it to have narrower handles for smaller framed individuals, and then it's very easy to load for anyone.
Yeah, the way you can load it is because the bar will be vertical and you can load the plates down pretty easily and then put it down. That's a game changer right there. Just that of itself. It
is expensive, but by far it's the best one. Plus the fact that it doesn't have a backside allows for a few different exercises that other ones don't.
It's a pretty versatile bar. Yeah. You can even do upper body stuff on it. The trap bar, what you said, the trap bar is also called a hex bar for those who aren't. But what the advantage of that bar is that you can sit in the middle, so your center of mass is in the middle, your axis of rotation, which is your hip, is closer to the bar. It's just an overall more user-friendly way of deadlifting. People tend to, because the handles are a little bit higher, people can have a more upright torso, so there's going to be less stress on the lumbar spine. Their chest, it's easier to keep their chest up.
So you would make that the standard rather than what most people would consider like the straight bar.
My general progression for hip hinging would be glute bridge, pull through, kettlebell deadlift, maybe go to an RDL variation where with the dumbbells at their size, and then going into more barbell stuff, it would be like trap bar, then into a straight bar. I have clients who I'll start on the trap bar and they become interested in doing a straight bar variation. And to me, they kind of have to earn that lift. Yeah. Because that to me, it is a progression. So really the only time that I'll make I'll differentiate from that is if I am working with a competitive powerlifter and he or she has to use a straight bar. If we're talking that, then we're going to talk about conventional stance, which is generally feet probably hip width apart, and then the bar's in front of you, and you're grabbing the bar with the hands outside of the knees. Right. That's generally considered like the pinnacle or like top of the pyramid or gold standard for deadlifting because it just is. I really can't answer it. It's just for
why is this guy? It's like a Joe. Joe Dirt.
Yes.
I don't know.
Why?
Why is this cool? Why is this guy? Why I think it's inappropriate to say, but why is the sky blue? It's just that's what the standard.
It's a great analogy, but we've been programmed to think that the conventional stance deadlift is the deadlift. Right. It has its disadvantages, of course. Like I think it's the more aggressive. It takes more mobility to get down to the bar. There's more shearing on the spine because your hips are further back from the bar. So from a leverage standpoint, it could be problematic for some people. And I think even Dr. Stuart McGill has done research in the past which showcase only 7 to 9% of the people that can actually pull off the conventional deadlift while keeping a nice neutral spine position throughout. Which is not a lot of people.
And it's probably less than that if you're working with people that are over the age of 40 and have been working behind a desk for even longer.
And
he's at a university, so he's pulling in healthy 20-year-olds. Be careful of that research. Yeah,
and there are ways to modify the conventional deadlift. Like the easiest way to do that is just elevate the bar. So I'll put plates underneath the plate. So like the bar is higher up on the shins,
right.
and it's just easier to get down to. But then from there, I guess the regression, if you want to say that, would be more of a sumo stance or a modified sumo stance deadlift. And I say that with a caveat because I don't think the sumo deadlift is a regression. I just think it's different. It's like saying a back squat and a front squat. One is not a regression or a progression from the other. They're just
variations
different. It's a variation, correct.
Yeah.
So with the sumo, we're obviously taking a wider stance. So our feet are now past hip width. Toes are generally pointing out a little bit. They're externally rotated a little bit. And now you're grabbing the bar with your hands inside the knees. This is an advantageous position because again, it's easier to get down to the bar. You're kind of reducing range of motion, easier to keep a more upright torso. Hips can get a little bit closer to the bar. So it's just overall probably a little bit more spine friendly, deadlift variation. And that's the one I personally use. I do more of like what I would call a modified sumo stance. So Oh, go ahead, Josh.
No, I was going to say, so if we're looking at your pie chart of the clients that you're currently training, or you've trained in the last, let's say, year, right?
Sure.
So most of the time, about 90% of them will get their hip hinge from the trap bar.
And this is where the internet can become an asshole because we all know, like with the trap bar, then you got the strength and conditioning community, like strength training Twitter will have an argument. Well, the trap bar is actually a squat. It's a squatty hinge. Like, cool. Yep. I don't care.
Yeah,
I want somebody to just do a hinge that's safe. Like, I don't care. I understand that we're getting a little bit more squatty pattern. I could care less. But you're right. Like that's generally
so you got 90% using the trap bar. When you do go for the remaining 10%, I'm going to get, for the ones that you do move to a straight bar variation, maybe half of those are doing a sumo variation. The other half are conventional. So we're down to like 5%.
I would even say I probably gravitate more modified sumo than I do conventional.
Okay.
Cool. Just because to me, it comes down to just risk benefit.
Okay.
I know.
Do you have a breakover point where you progress from a straight bar, like say 2 times body weight in the trap bar or something like that?
Yeah, exactly. So I feel like once they get to the point where they can like own roughly a 2 times body weight deadlift for a few reps, then I know they're probably strong enough that they're not going to get in danger. They know spinal position. They got body awareness.
Which for Roseman Pike's got to be about 190 pounds. I think it's 2 times the body weight, right?
Yeah, she wasn't a big individual. Yeah, no, for sure.
Just get a couple 25s on either side and you're at 2X, baby.
Sure, she's there.
Yeah.
But honestly, for the bulk of people that I trained, I had some that had been with me for 4 or 5 years. Like they just stay with the trap bar. They don't, I mean, that's their deadlift. Yeah. Again, but I could probably skew it to my older clientele as well. Probably if I were to have somebody gravitate to a straight bar, it's usually the people who are a little bit, under 40.
My mind is going, okay, this person can live in downtown Boston and afford personal sessions with Tony. Like they're not young and they've done well professionally.
They're doing okay for themselves. Yeah,
exactly. Yeah.
And
one question I have is when you, one thing I struggle with, and I would love for you to help me out with this. For a lot of people coming, so I'm a chiro, and a lot of people, when you're getting them back, I have found that I would say 60 to 70% of people, I think it's safer to progress them back to a hip hinge going single leg first. So like an RDL or, a slider lunge or something like that, right? And I don't know if it's that when they lock both feet in, essentially there's a little more shearing in the lumbar spine or what the reason is. But I'll typically do that and get them comfortable holding some weight in their hand and then progress them to, say, trap bar or some other hip hinge. But I don't know what is the equivalent of a heavy trap bar and a heavy RDL? Because when you do that single leg kind of training or some people argue, like your Twitter people, that, is it really single leg or is a slider lunge a single leg? Like it's a split stance, whatever. But how have you found to know when to progress people or when to regress them into a RDL, like single leg RDL?
So you're talking if they're coming off of, if they're working back from an injury, like just finding their entry point from
just for sake of this argument, let's say that we've cleared them of that. Like, so they are cleared hot, but they're not strong enough to do 2 times. Trap
so
bar.
If they're cleared, I like the RDL because what the advantage of the RDL is that you can do from a top bottom position. So you start in the top position, you're standing, you're not starting from the floor.
Okay.
They can lower the bar towards the floor, feel that bottom position, stand back up. So I often find it's advantageous to start people in the final position and that way
like a Turkish get up sometimes is easier that way where you
even with lunging, like I found sometimes if I have somebody do a split squat, like if I start them in the standing position and have them lower to the floor, they're all wobbly. But if I start them from the floor and have them stand up, they're like, oh, okay, I got, and it's way cleaner. It's just like you're kind of like, I don't know. There's probably some neural term for it.
Sure.
But I find with an RDL, like that is the advantage of it. Like they kind of get a sense like, oh, this is what lockout feels like now, and they'll hinge back, they'll lower the bar to the floor and they'll feel what the bottom position is and stand back up. I don't know if that answers your question.
Right? They could
or drop it. Yeah, certainly you can drop it too. Sure.
So I was saying, like, if when do you transition from RDL or single leg to a bilateral stance, and where do you have any transition points or checkoffs that you look for?
I guess I eyeball it honestly. Like if I can, as a coach, I've seen it so many times. Like I can see somebody if they've mastered the single leg hinge, and I agree with you. I think that's a great starting point for a lot of people because we do need to learn to hinge on each hip. Mm-hmm. Once they master it and they're keeping a neutral spine and I can, I'm not scared to load it. Like if they have half body weight in each hand, let's graduate to the trap bar now.
So roughly if you can do, let's just say you're a 200-pound athlete, if you can single leg RDL with 100 pounds,
I would probably say 50 pounds in each hand. So 100 pounds. So they're RDL, they're single leg RDLing half their body weight.
Total load is half their body weight. They can check off a few reps on either side. And you as a coach go, that looks pretty clean, pretty smooth.
Let's go.
Then progress to the trap bar.
Yep.
But it's not going to be equivalent of weight, right? Now, like.
No. I mean, then we start talking about the bilateral deficit. Yeah. So then, I do.
Which, by the way, just go mention that on Twitter and see your feed will blow up.
I know. I think people tend to get to their own heads. Like it's not honestly like this is a great example. I just started working with a 13-year-old female, and who's an athlete, so she knows her body. Mm-hmm. I'm not scared. Nothing I do in the gym is going to be more. Put more force on the body than anything she's doing playing field hockey or basketball. I was not afraid to just load up 95 pounds on the barbell and say, okay, lift that off the ground for 5 times. And she crushed it. Like,
what do you think she weighs roughly?
She weighs probably 110.
So you're close to a full body weight.
Close to full body weight already. Yeah. I mean, without even me like worrying about it. Like people are stronger than they think they are. And even if I'm working with an older female client, like the same thing, like I'll put 45s on there and just say, okay, let's go. I mean, within reason, like I can, if they've never lifted a weight in their life, again, I'll probably start with 95 and even 100 pounds is intimidating to people. Like, oh my God, I just lifted 100 pounds. Like,
that fine. Is, I would love I would love to pick your brain and like Dean's and Eric's about this. Like, I do love those moments. And I always say they're like the aha moment. So like when a woman does her first pull up unassisted, no bands, no nothing, and gets her chin clean over the bar, like the angels start singing and like, holy crap, I can actually strength train. Bodyweight deadlift, I think is somewhere in there for both sexes. I think 100-pound deadlift for women is one of those aha moments. Like, oh my gosh, I'm really strong. And I'm like,
and many times, Josh, like 100-pound deadlift can be done on week 1.
But it's just all of a sudden when you tell them that's 106-pound kettlebell, they're like, what? Like a 3-digit number? What?
Yeah, huh? It's great, and I love it. I love it when the switch flips and they're like,
it's great because they buy off on the fact like I am strong, and you're like, I know, I've been trying to tell you that for weeks, but I'm glad you realize that, and let's go.
Let's go. it's a nice discussion to have. Like, okay, given this, like, let's do this now. Like, I think it's a nice way of managing expectations and giving people a goal to strive for. Like, I remember when I presented over in, back 2016, I think, no, 2018. I was in Bonn, Germany. And I presented at a gym there, and I loved it because on their wall they did semi-private training there, so they would have 3, 4, or 5 people training at a time, and they had their strength standards on the board. So they say, okay, if you can do this, your progression's this. If you can do this, your progression's this. If you can do this, your progression is this. And I like that because then when people can see, like, this is what I'm training for. Like, I can do this now. This is what I'm training to be able to do. And I do think there's a motivational factor there. If you, I mean, I think I haven't done it myself. I probably should, like, have like a chart that's just up there. It says, okay, here are the progressions of, okay, goblet squat to a 2 kb goblet squat to a front squat to the, like, given you can do this, like, at this weight.
I think there's a huge advantage for those people listening too, from a business perspective and a psychological perspective. If you can walk over to a poster and point to it and go like, hey, this is where I would like you to, Tony, I know you're coming back from back pain and your pain's under control. That's awesome. I want you to get in the mindset that in about 3 months, you're going to be able to do this with this standard weight. So you're going to be able to do a 2 kb goblet squat with, with body weight. Right. And they're like, there's no way. And be like, and then you point over in the gym, you're like, see Carl over there? He was where you were like 4 months ago, and he's already 75% of the way to that goal.
Yeah.
You don't want Carl to beat you, right?
Yeah.
But then the other effect is, like, nobody ever walks into a karate studio, looks at all the different belts on the wall and goes, how much would it be? How long would I train to go from white and stop at red? Like, nobody's ever asked that question in their life, right? They're like, from white to black, I want to go, and it's okay to say like 3 years, 5 years, whatever. But yeah, I love that idea of like posting it up and just making it clear for everybody so that it just reduces the arguments, because it's no longer Tony's opinion of what should happen. It's, dude, that's just the map. I think my wife would say that provides extrinsic motivation, but then there comes an intrinsic motivation out of that. So it's a very powerful way. Advantageous to the client, right?
Sure.
Yeah. So you did say that you, going back, so we've addressed straight bar, trap bar. We've talked a little bit about like RDLs, and early on you mentioned like glute bridges and pull throughs.
Sure.
Can you explain quickly for the listeners what a pull through is, in case people aren't using it?
A pull through is a funky looking exercise for sure. That could be done with a band or a low pulley system. Essentially, you're looping one end of the cable system or band to the weights, and the other end is attached to like a rope attachment of sorts. And then the rope attachment is kind of like in your groin area. You're standing nice and tall. And then from there, what you do is you hinge back and reach back through. So like your hands are going past your groin back. So you get like hamstring glutes.
If you could picture in your mind what somebody looks like as they're being thrown off a mechanical bull, at the moment they're being thrown off is essentially what the pull through looks like. They're hanging on for dear life and their legs are in front of their hands. That's essentially it. But so when do you find that that's advantageous? Because what's interesting is here, you're getting a resistance to the hip extension motion with no axial force or pressure on the spine.
So what I like about it is it's a very spine friendly hinge range. So you're getting little, if any, axial loading, but you are stressing or targeting posterior chain. So hamstrings, glutes, erectors, etc.
Right. And they can't squat it, right? I mean,
I guess you could. I mean, the one major, I would say, almost one technique flaw I say it's not an up and down motion; it's a forward and back motion. So I say, if I find that people are breaking with their knees and they're squatting it down, I say, okay, soft knees and sit back like you're trying to shut a car door with your hips.
Okay.
And what I like about the pull through too is that a lot of it, the weight kind of tells you what to do. Like, cause the weight's pulling you back. Right. From there, it's just a matter of like, just making sure people keep a good spine position. Cause then the other fault that I see a lot of people make is as they're sitting back, they might round their shoulders a little bit. So I might be there to say, pull their shoulders back and just say, make sure your shoulders stay above your hips. I don't want the shoulders to go below the hips.
Okay.
But yeah, great exercise. And actually, since we kind of touched on people coming from injury, say someone does have a lower back injury. I do find that's a nice entry point for the hinge, because again, there's very little loading on the spine, and we're targeting neutral spine, of course, and we're strengthening pelvis, abs, hamstrings, glutes.
And do you have any hard and fast rules of when to progress somebody from that to RDLs or something like that?
I don't. A lot of it, if it's somebody coming off of an injury, I dictate it by their pain, if is pain present. I want it to be, I use that 1 to 10 scale. I don't want it to be above a 3. But I'll stick with that drill for, 1, 2, 3, 4 weeks just to build their confidence and build volume. And then once the pain has subsided quite a bit, then I'll say, okay, well, let's go to RDLs, because then entry point is just like tempo, iso holds. Like I often find a lot of times when it comes to like low back or knees, I'll still have people hinge and squat, but I'll have them go super slow. And that way they're using a much lighter load, but they're getting more time under tension and they're controlling the motion, and they get a training effect. So like they're like, oh shit, like, oh man.
I took a Olympic weightlifting course over a weekend one time, and we never picked up anything heavier than a PVC pipe. Or a wood dowel. And it was super slow, super like, and I woke up the next morning and I was like, I think I've torn the labrum off both hips and both shoulders. Like I'm so sore in my joints. It's unbelievable.
Yeah. And so I often tell, like, prior to COVID, I'd have trainers come in all the time and shadow me and observe. And I often tell them, like, don't be scared to slow your clients down. Like you have to control slow before you control fast. And particularly with coming off injury, isometric holds, like holding one position because they carry over above and below the joint, but then, just slowing people down and with a lighter load. I mean, that doesn't have to be heavy. Of course, we want to get you there at some point, but I'm more interested in getting you a training effect. You doing goblet squats with a 5-pound dumbbell for 20 reps isn't going to do anything. I'd rather load it a little bit heavier.
When a Salter would argue with you, man. She would tell you you're wrong. And 5
You're
pounds
wrong, Tony Gentilcore.
A little too much, yeah.
So yeah, pull through. I mean, I don't have like a set, like, okay, you pull through this much weight. Now you're going to graduate to an RDL. I just kind of eyeball it. I know it doesn't sound like
quality movement over multiple reps. You think you can progress on?
Correct.
Okay.
Yep.
All right. And then of course you said like glute bridge was kind of the.
Well, that's right in there. Like, I don't like loaded, super heavy hip thrusts and glute bridges. I do barbell glute bridges. I do barbell hip thrusts in my clients. Although I will say more often than not, I'm using bands rather than the barbell. I actually prefer those exercises a little bit higher rep, but I still like them to have a lot of tension. So that's why I like the bands. I'll generally do those movements for 10 to 20 reps per set. But I don't like it when people are putting on, 405 pounds on a barbell and doing hip thrusts or glute bridges. Like, yeah, cool. It looks fine on Instagram, but I don't find there's a ton of carryover to athletic endeavors or even lifting numbers by hip thrusting a ton of weight. Like,
it is interesting because, like, I mean, if anybody listening, if you follow Brett Contreras, who's kind of made that exercise popular. Number one, I don't want to ever mention his name without saying smartest man in all of fitness to target a population that loves him. Loves, like, hey, Brett, I want to come in here and I want you to tell me how to make my butt look better. And it's like, okay, and you're not going to get offended if I tell you it doesn't look great right now? No, I'm actually going to pay you more money if it doesn't look great right now. It's like the only man on earth where women are paying him to comment on how bad their butt looks. So Brett, you have won. Okay. Like, let me just establish that. But what's interesting is, I always wonder with the women you see that are working with him, they're doing, I got to give them to them. They're doing like 4 times their body weight on a bar across their hips. And I'm like, congratulations. That's amazing. You're willing to load that heavy. And I just wonder if they loaded in other exercises, if they would have similar effect, because he does produce some great hypertrophy. I mean, you cannot deny the hypertrophy.
And that would be the point. Like, I think that would be the point. They want a nice looking.
Yeah. Like when people dismiss him, I'm like, okay, you're not like the client's goal is being met.
Sure. I don't dismiss the movement at all.
Yeah.
I know that's not what you were meaning from me.
And it's a safe environment. Like it checks off all the boxes. So anybody that's hating on him, I'm like, not that you were hating. I'm not saying that. I'm just saying when a lot of people are like, oh, that's dumb. It's like, well, there's a lot of positives here. But going back to what you said of, it's like the old, back in the day when you and your bros would do the leg press at like 24-hour fitness and like load it up until you couldn't load it up anymore.
Yep.
But then like, okay, 945 pounds on leg press. And then you go to the squat rack and you're like,
185.
And you're like, hey, take off that 25 and put a 10 on. Like I'm smoked. And it's like, that translation effect. Now, I don't want to ever negate anybody doing leg press because I've seen some people, it's not the most functional exercise I've ever seen. And certainly as a clinician, I don't think it's great for people, but you're under tension, your legs are pressing weight. Like there's some good there. Yep. But it certainly does not translate at all from what I've seen to any reasonable number on the squat. Like,
and I think, and it's all about the point of the exercise. More often than not, it's about hypertrophy and building big legs, and that mission accomplished.
It's weird though. Isn't that weird to you? Like I don't know if it's to get the same training effect or tension in your legs just becomes a spine weight bearing issue. And that's why they go to leg press. Like what could Ronnie Coleman do to get a similar effect below the waist? You know what I mean? Like just time under tension and load. But anyways, this discussion should be now happening around a campfire with booze. Like I'm violating the rules of the universe.
Where's the whiskey and
I'm very sorry. I'm dragging you into this broad daylight with no alcohol. Anyways, going back to hip exercise. So, you use glute bridges in kind of their standard thought.
Well, I'll use it as just kind of like a building contact. So if I'm working with a stark beginner, I do think that's a nice way of introducing the anterior posterior aspect of a hip hinge in a more stable environment.
Yeah.
Then I might progress that to a tall kneeling hip thrust where they're in a tall kneeling position, the band is around their waist and they have to hip hinge front and back. In a tall kneeling position, and then I'll make the progressions to pull through RDLs, blah blah blah. I just think but then some people and that might take a session. You get some clients that just bang. Like I just started with I had an assessment with a woman on Saturday who was a hip hop and classical dancer for years and years and years. Has great body awareness. Like her set, I was like, do this. She did it. Do this. Do that. And she's going to be somebody where, her session 1, she's probably going to be doing like a plate loaded front squat. Session 2 will go to goblet squat. Session 3 is going to be front squat. Like she'll progress pretty quickly.
Others 8 progressions in 6 sessions.
Yeah, maybe. And I'm not scared to do that. Like if they crush an exercise and they do it well, then okay, let's load it. And if you're still crushing it, okay, let's progress. Let's go. So I never really go by any set, like you have to do it for X amount of sessions or weeks or whatever. It's like, no, if you're doing it well, then let's progress, keep going.
Yeah. You're making, as always with these podcasts, a podcast is the greatest thing because I get to talk to people way smarter than me, way, better at training than me. And I just sit here and I think like, I wonder if, and then I think of all the people I've been screwing up to this point. So I do appreciate this. No, although here's one tip I did learn for the glute bridge for those listeners. I don't know if you ever tried this, Tony, but tell me what you think of this or shoot me an email in a couple of weeks. To teach people how to hip hinge and using the glute bridge to do that, you know that a lot of people glute bridge essentially with their back or with their hamstrings, and they won't actually do a glute bridge. They will do some other posterior chain bridge.
Sure.
When they're down on the floor, just walk up to them, put your hands on their ASIS and load the crap out of them and tell them to raise you up. And almost everybody will self-correct in like 2 reps to the point where they're like, oh, okay. And because they realize if their pelvis is totally thrown off, their pelvic position sucks, all this stuff. Try that and tell me what you think of it. Because I learned it at a seminar and so far it has worked with, I would say, greater than 90% of the people.
All right, I'll definitely try that. I like that.
Yeah. And I mean, especially when you're early on the relationship with the client and you're just trying to go, hey, this is what posterior chain engagement feels like. Load them, they get it. And then from there, you just keep asking like, where do you feel it now? And they're like, oh,
yep.
yeah.
And that's a key component. Like that last line you just said is a key component. Like, where do you feel it? If they're, with the glute bridge, if someone, generally speaking, of course, if I find that somebody is feeling it too much in their quads, their feet are too close to their butt and they're pushing through their toes. If they feel it too much in their hamstrings, generally speaking, their feet are too far away. So I want that 90-degree angle of their tibia, shin, the vertical shin. Yeah. So that's another way that I've looked at it too. But I do like your idea of like pushing down and saying, okay, push my hip, get me off the ground. Yeah.
Yeah. Tell me what you think.
I will.
One other thing too, just for everybody listening, the reason we have to assess, I had one patient in the history of my practice, but one patient who had back pain literally from hyperactive glutes. You never heard about that, have you?
Well, I know. I mean, it's yes, I have heard of it because I'm a big fan of, and maybe you've heard of her, Dr. Sarah Duvall.
I have not.
So she has a course out there called the Postpartum and Pregnancy Corrective Exercise Specialist, and it is without question the best home study course I've taken ever.
Wow. That's saying something.
It is phenomenal. And she just rebooted it. Like she just redid the whole entire thing. It's 33 hours of,
wow.
And it's, I mean, I had an epiphany with that too, because I was like, 50% of my potential clients are women. And many of them are postpartum, and postpartum doesn't just mean you just had a child. It could be you had a child 2 years ago, 3 years ago. Right. Once you're postpartum, you're always postpartum. Yeah. And there's a lot of stuff that can be awry there. And she talks about
also another term for it is mom. So anybody's calling you mom, you are postpartum.
You are postpartum. Yeah. But she references like glute clenching often.
Interesting.
And how women tend to over clench their glutes, and that can manifest into a lot of anterior hip pain and and like just stuff going badly. So it doesn't surprise me. I mean, it's not again, like you even said, you've had one person in your entire practice
patients.
So it's rare, but people do over clench their glutes. I'm not to the point where they're hyperactive, but they emphasize that glute clenching too much, which can lead to some issues.
That's why it's all, that's where experience is required. It's also the most frustrating thing to hear when you're young. Oh, you just need some experience. So I don't ever want to discount that feeling. I'm sure you heard that. Oh, it'll just take time, Tony. And you're like, I don't have time.
I want to know.
I want to know. Yeah. Well, I want to respect your time and wrap this up soon, but I do have one burning question I want to ask you. For those people who are listening, who maybe are new to the game of training people or new to the game in their strength coaching and whatnot, you have had, I would say, the pleasure. You've certainly put yourself in the right rooms at the right times. You've learned from some of the best people. Living in Boston just by chance happens to be the mecca of North American strength training. Right?
Yeah, it's pretty good here. Yeah, it's pretty good here.
Yeah. So, but for those people who are getting into it, do you have any tips that you would say, regardless of where they're coming from, tips that will help them progress faster in becoming an amazing strength coach? Or
this might be a very lame answer, because I have two ways of answering this. Number one is always have an insatiable appetite to learn, whether it's digital content, ebooks, blogs, articles, podcasts, whatever. You're always going to learn something. I know
whenever throw out some names real quick of either, because you just said a woman I've never heard of, and that sounds like a very interesting.
Dr. Sarah Duvall. She's amazing. She's awesome. Yeah.
Some other names of
and
people.
She's here. She's in Boston.
Shocking. Yeah. Well, it's always weird to me. Like, I'm originally from Southern California, LA, for being the biggest population density in the US, right? The greater Los Angeles area. It's just not producing that great of info like Boston is, for whatever reason.
Chris Hitchko, he runs a Instagram account called Show Up Fitness. Okay. He is the go-to guy that I point young fitness professionals to out there. Okay. So any young fitness professionals looking to better gain the skills they would need to actually be successful in this industry, like he is perfect. Like he is, he's kind of like I don't want to put words in his mouth, but it's kind of like the anti-NASM approach where it's like, let's not over assess people to death. Yeah. We do need to assess them, but let's assess the things that are actually worthwhile and learn how to actually coach a squat and a deadlift and progress stuff. Yeah. But
I think everybody listening would be served. I've said his name many times, but Ben Bruno.
Yeah, Ben Bruno's
if nothing else, for the funniest dude you'll ever meet on Instagram, but also is a testament. You know, he's training a lot of people who are very aesthetically conscious, but he will not address strength training with everybody.
Sure.
You know, like he's working with a lot of movie stars and models and whatnot, and yet he's still like, hey, we're going to lift heavy weights. And the second thing is, guy maximized a tiny space. Space.
I've been there. I've been in there a few times. It's tiny.
You could probably touch both walls with your hands on. Right?
It's about the size of my dining room. And he's training some pretty famous people out of it.
And he's making a good living in a place that's tough to do that. So I think he's great. Any other recommendations for people to follow or learn from? Or
people to follow? I'm partial to. I mean, like you said, I'm in a very dense area of fitness professionals. So people, of course, know the big names like Eric Cressy and Mike Boyle, but Dan Pope and Mike Reinold are both out of Champion Physical Therapy and Performance in Waltham. They're excellent. I think for clinicians, especially Mike Reinhold's great because even just on his Instagram, I think it's like ongoing education because he breaks down every orthopedic test you've been taught and talks about like, why do we even check this? And what should you be looking for? He's really good at that. Yeah. And he does it in a humbling way. He's not like chastising anyone. He's just like, why are we doing this? Yeah. So you mentioned Dan John earlier. I think Dan John, of course, is always a read nice his one. Read his books, go to any lecture you can when that man is talking. I guarantee you will be a better person coming out of it. Yep. Dean Somerset, Luke Worthington, Sam Spinelli, Megan Calloway, Melanie Red is a fantastic female strength and conditioning coach. I forget where she's located, but I've been following her on Twitter. She's phenomenal. It's just R-E-D or R-E-D? It's Red with two Ds. Okay. Katie St. Clair is awesome. She's down in Charleston, South Carolina, and she's very much into, she's gone down the rabbit hole of PRI, Postural Restoration Institute, but she has a great introductory course, Lumbopelvic Foundations, that I found very helpful. But it just goes into owning canister position, pelvic position, and how breathing kind of interplays with that and how important it is. So she's great. Vernon Griffith he's like my latest man crush. He's based out of Virginia Beach. He's been putting out awesome content on Instagram. Yeah. There's a lot of people out there. I know it's like, I got 4 names here I haven't seen of or heard of, which is a good problem to have, always finding more. But yeah, I do appreciate these. The other ones I would say are somebody that I was turned on to a few years ago, but just have been following lately as well, is Mark Fisher. Yeah, Mark's a good friend of mine. Yeah. Yeah. For those listening, Mark Fisher runs a gym that is exactly what he wants to run and doesn't get scared of it. And then I recently started following, I think another friend of yours, Pete Dupuis. Yeah, Pete's a good friend of mine. Yep. On Instagram, and he's more, I would say it's more business oriented, definitely. Yeah, he puts out more business, like the business side of fitness, because he's the business director of Crusty Sports Performance. So he's got a lot to say on that. But Mark, if you want to talk about business, like you're right, Mark Fisher, Michael Keeler, who are both the owners of Mark Fisher Fitness, and Pete, you really can't go wrong with those 3 guys. Yeah. I mean, they Mark and Michael are fantastic about relatedness and building community. As well as Pete, but Pete gets more into like the numbers and like, building employee, what's engagement or employee engagement, but also like camaraderie, and like systems of like, running, 2 separate facilities, one up here in Boston and one down in Jupiter. Although he has less to do with the day-to-day down in and actually they're not in Jupiter anymore. It's Palm Beach Gardens. Yeah. But yeah, they're great. Yeah. Well, listen, we started out talking about the hip and we ended with talking about whose hip. So I think we've done a good job. Well played. Well, nice bookmark. Yeah. Yeah. Thank you. It's called a callback, my friend. Yeah. Yeah. Lesson learned. Yeah. Well, I've had a hoot here, Tony. An hour has flown by like super quick.
For those listening, once again, where can they find more about you and your courses, your products, etc.?
That's my website. So it's my name, TonyGentilcore.com. That's the hub. It has all my social media and blog posts and everything on there and resources.
Fantastic. So, and just, so we're recording this and what are we in mid-April of 2021? Are you getting pinged to go out on the road? Like, do you see some live in person?
I'm itching so bad. I loosely have something that I'm hoping to get out to London in October.
Good.
My buddy Luke Worthington and I are hoping to do something out there. But I speaking of Katie St. Clair, I mentioned her about 5 minutes ago. I just reached out to her the other day asking if there'd be an opportunity for me to come down to Charleston and do something down there. Cool. But nothing yet really.
Okay.
I'm still kind of, I don't think that's going to be, I think next year, of course, I think it's going to be more, it'll be more open, but I'm hoping for, I'll do some stuff in the States starting in the summer. I'm one shot away. I'm halfway done being vaccinated. But I'm hoping that maybe I can get out to London in the fall. But we'll see.
Fantastic. Well, I'll look for you out on the road, man. I hope we run into each other.
That'd be great.
Yeah. So thank you so much for the time today, Tony. And on behalf of Tony Gentilcore, this is Dr. Josh Satterlee saying, go out there, maximize your license, and live the life you dream of. Thanks a lot, Tony.
Thank you.
Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there, here, or anywhere to get more videos just like this. Thanks a lot for watching, and we'll see you soon.